Congresswoman Bonamici and Congresswoman Dexter. I will pass it over to them so they can make some remarks. Thank you so much.
Thank you. I'll start. I'm Suzanne Bonamici. I represent the 1st Congressional District. I want to say thank you so much to Outside In for hosting us at this critical moment. Thank you to Representative Maxine Dexter, who's with us today, to Iris Haven and everyone at Outside In. Thank you for all you do in our community. In the past several chaotic days, President Trump has caused fear, confusion, and a lot of uncertainty. His direction to freeze federal funding has left local governments and community organizations like Outside In scrambling for answers. I want to be clear. The president does not have the power to block funding that Congress has already directed and appropriated. For him to try to change that is illegal because of a law that was passed, but also unconstitutional because of separation of powers. And this planned freeze of programs threatened lots of programs that feed infants and new mothers, programs that help people pay their heating bills, provide affordable childcare, cover health care. Like we just toured the clinic here and heard about their concerns about what happened, and much more. So my office got a lot of calls, and I'm sure Representative Dexter's did as well, from constituents who are really concerned and fearful. Oregonians whose medical research projects, for example, were canceled because National Institutes of Health could not distribute the funds. A professor was worried that their students would have to leave school because their financial aid was blocked. A mother who has an adult son with disabilities contacted our office and said her son would die if he did not have Medicaid. So this is just a small sample of the harm that was caused. And I was just mentioning inside with the Outside In staff that Senator Wyden had confirmed that every Medicaid portal across the country they were locked out or frozen. So this is unacceptable. Oregonians aren't going to stand for it. Americans are not going to stand for it. There have been 2 lawsuits filed already, one by nonprofit organizations, including the American Public Health Association, SAGE, and others, and then another by Democratic state attorneys general, including our Attorney General Rayfield from Oregon. And their judges agreed you cannot allow the president to end this funding that Congress has already approved. And then it got further confusing because then the Trump administration said, well, we're taking away the memo that outlines these cuts, but we're still going to restrict the funding. So that didn't help any, it just caused more chaos and more confusion. We're not going to stop fighting this and speaking out. Now, these are our tax dollars that come back to Oregon and help, particularly with vulnerable communities. But from everything from education to healthcare to environment, these dollars that are threatened are dollars that Congress approved. So we're not going to stop fighting. Fortunately, we still have a system of checks and balances here. I'm right now the only Oregon House member who served during the first Trump administration, but I know Representative Dexter and our colleagues know it's important to remain steadfast even through this chaos, because every day it seems like there's more executive orders, but the president is not a king. And we do have checks and balances in separate branches of government. So he can't just do whatever he likes, and we all have a part to play as elected officials, but also everyone as community members and leaders to keep speaking out. It really does make a difference to hear your stories. When we heard that Outside In has only 52 days of reserves, and if that Medicaid portal didn't open up, they'd have to start using their reserves, and that means care for your community is threatened. So keep telling your stories, keep speaking out, and we'll keep sending those messages and working as hard as we can day to day to fight back and to meet the needs of our community here. So I'm really honored to introduce my friend and fairly new colleague, wonderful addition to the Oregon delegation, someone who really appreciates the importance of access to healthcare, Dr. Congresswoman Maxine Dexter.
thank you, of course, to Congresswoman Bonamici, our dean of our delegation, and has led us all through these hard times with steadfast consistency and leadership. Thank you to Iris, to Haven, and everyone at Outside In for hosting us today. Oregonians depend on federally funded clinics like Outside In for a huge proportion of their care. I just completed a tour of this facility, which I've had the honor to work with in other areas, and we continue to see firsthand the incredible services that Outside In offers our community. And yet Trump, in all his cruelty, is trying to cut off funding for these desperately needed services and for patients who rely on this facility and facilities like it across the state. The harm that would cause is undeniable, and it is without question that we have to stand firm together and press on with the stories and the information that everyone has. The fact that Iris has the ability to communicate quickly with other FQHCs is critical so that everyone understands how we are going to stand fast and move forward together. 1 in 10 Oregonians receive comprehensive care at a federally qualified health clinic, otherwise known as an FQHC. His attempt to pause, again, as Congresswoman Bonamici said, we don't know what pause financial assistance means, but it's a threat, and it's meant to be confusing, and it's meant to create chaos. It was also, as Congresswoman said, it's illegal. It is unconstitutional, and we will not accept that as an outcome. We won't back down, and neither will this community. What is cruel and uncertain is going to make us stronger. We must stand firm together. The only thing that we know for absolute certain right now is that Trump is going to continue to try to create chaos. And what we have to do is focus and remain vigilant and remain loud. And so as Congresswoman Bonamici said, what is super helpful and impactful is to share your stories, to tell us what's happening. If you can't get on the portal to make sure our teams know, we can't do our job without the information from this community. So making sure that you are staying in close contact, again, staying close, staying tight, and pressing on is what we must do. I'm going to now pass this off to Iris Martin, the interim co-executive director of Outside In, who is doing tremendous work with her team to serve this community, and especially our people in the city of Portland.
Thank you, everybody. Thank you, Congresswoman, so much for showing up today. Y'all, to talk about our services, I'm actually going to hand it off to our Haven Whitlock, who does amazing work every single day. Please come up and speak. Thank you all.
Good morning, friends. It's an honor to be here with you today. I want to huge thank you to both of you for coming out again. You've seen it, you've come before, and we welcome you back. And thank you for being here. Thanks, Iris, for giving me some space to talk. My name is Haven Wheelock. I run our harm reduction programs here at Outside In. I have been with this agency and serving this community for over 18 years. Part of the magic that is Outside In is our core belief that all people deserve a place to feel cared for, supported, and seen. We believe that regardless of someone's gender, immigration status, skin color, substance use, housing status, should not dictate whether or not you can receive health care and medications that you may need to be healthy. And that health is so much more than just medical care, right? It is a full spectrum. We create programs that show people love, kindness, and joy, even in these really dark and really hard times. We believe that we are part of this community. We are not serving this community. Our staff are reflective of the people we serve. We have former clients of this program who show up here to work every day. And we have been doing this work for over a century, or a half a century, not a century, a half a century. I get excited. Even before this administration took office, things were really hard for our clients, for our patients, and for our staff. We are in a housing crisis. We are in an addiction crisis. We are coming out of a respiratory pandemic that has exhausted every resource that our healthcare centers have. And we are watching as more and more people are emboldened to push hate. We are watching policymakers creating policy to erase the trans community, sweep away the unhoused people, vilify people who have moved here from other countries. Shaking a little bit. And these targeted groups are groups of humans that we as an organization have always strived to serve and worked to serve. We have a long history of doing what is right, whether it is popular or not. We were providing gender-affirming care here at Outside In before those were words we used to talk about healthcare for transgender people. We are providing new syringes to people who inject drugs in times when very few organizations were willing to do that out of fear of the war on drugs. We have always ensured that no matter what language you speak, you can come into our clinic and be able to get the health care that you deserve, no matter their immigration status. And it's not just the past. We haven't been brave just in the past. We are brave today. We have seen how our systems have failed so many and are so dedicated to actual solutions. We saw how our BIPOC youth were not getting the supports that they need to thrive and have created programs to better serve them and expanded our reach in that way. We've seen how the intersection of mental health and substance use was making it harder for people to find stability, and have expanded our behavioral health teams as well as our substance use teams. We saw our drug supply changing and becoming more deadly, and we launched the first in the state program to do drug checking, while at the same time expanding our substance use abuse treatment to a much wider range of folks. So we are much better able to meet people where they are, no matter where they are, in their use or on their recovery journey. And we have done all of this while we are tired, and while we are hurting, and while we are scared. The work we have done has never been easy. We have lost people we've cared for deeply. We have sat with people who are cold and who are wet because they're sleeping on the streets in the rain. We have been told if not for our spaces, people would not feel safe and cared for. We hear it time and time again. And with these threats coming from our federal government and from our current president and administration, we are sitting with more fear and hurt than I have seen in my 18 years here. Our clients, patients, and staff are scared about whether or not they will be able to continue their medications that they need to be the true human they are today. They are questioning whether or not it is safe to come in for a medical appointment for fear of deportation. They are worried about whether or not the federal government will honor its commitments and its contracts that help us keep doing the amazing work that we are doing today. And I would be lying if I didn't admit I am scared too. We don't know what is coming. We have more questions than we have answers for, and that is scary. The policies that are being suggested by this administration are cruel. They are intended to create chaos and uncertainty, and if enacted, they will, without question, kill people. People will die. People will lose their jobs. People will lose their stability. We will continue to provide gender-affirming care, harm reduction services, and will never deny you because of your immigration status. We will be brave together, and we will continue to serve our community just as we always have. We will not cave to fear that Trump seems to want to create. Thank you. Thank you.
Thank you to Haven and Iris and Representative Dexter. I want to emphasize something that we just heard about how so many people who come here for care, then they end up working here. I mean, this is a path, it's a healthy way to get back on your feet, to contribute to society. Thank you for your bravery, but really thank you for the hope that you give to the community. We're Maxine come on up. We're willing to take some questions.
So it's only been a week and a half. He's already gone all over the map. How do you keep up with that? How do you
Well, it's a day-to-day, hour-to-hour issue, and every day it seems like there are new executive orders, and the confusion and the chaos is part of the game. We have our caucus, we have each other, we have our amazing staff. All the staff, raise your hand. We have amazing staff here today, and every day we're doing what we can to keep up with what's happening, to push back where we can, and to fight back, because what's happening is, again, creating chaos and uncertainty. And you just heard the humanity in this message about how we as a country, we as people here in Oregon care about each other and want to take care of each other. And we're not getting that message from the White House. So we're here to support everybody, to say, please, again, keep in touch with your stories. And we're doing everything we can to track it and to push back when we can. Obviously, some of us will get areas. Representative Dexter can answer, but probably some healthcare issues. I'm going to focus on a lot of the education issues, and some of the education executive orders came out yesterday. So we're just going to keep fighting back. And I have to say that we're hearing it from across the country that there's so many people who are with us because they're seeing, wait, we thought our life was supposed to get better. We thought our eggs were supposed to be less expensive. We thought it was going to be great. That's not happening. People are seeing that, hey, these promises are not what we expected, and they're really getting chaos and confusion. And as I like to say, they're kind of realizing that they got some snake oil from the salesman. So I'll let you.
I would just add that this is a great betrayal. Donald Trump has made promises that clearly he had no intention of keeping, and trying to get us to scatter, flooding the zone and trying to get us to look at every single thing is what they're trying to do, and what we're going to do is focus. So as the Congresswoman said, healthcare, the environment, and veterans are where my team's really going to be focusing. I'm a critical care physician. I've got an ER nurse as a chief of staff. We are already going into the kind of response that you have in a crisis. So you focus, you delegate, and you make sure that you don't get distracted from keeping people safe and making sure that we're hearing from our communities. And that's our first priority.
Do you now have to pay, you got the governor, attorney general, do you all have to work together more now than?
We've always worked together with our state and local elected officials, but it's reassuring to know that we have Governor Kotek and Attorney General Rayfield as well involved, because these issues affect our state. They affect our community. They affect our local government. So yes, we're working with our state and local partners as well.
And just to be clear, some of the things he's saying that he can take action on have nothing to do with federal reach. So it's really important that our local and our state electeds are in communication with us so that we are focusing. I was in Salem on Tuesday meeting with the governor's team and Rayfield's team and others, and we will continue to be in contact. But again, these are really smart, directed people. They understand that you can't take away federal funds and impact our schools. Our schools are safe. We need to focus where a lot of this is meant to distract and confuse, and that's really what we're trying to all avoid at all costs. And it's hard when people see all these things and read the news. So again, don't keep your kids home. Don't avoid going to the clinics. Show up and be together and do it in community so that when we are separated, we become more vulnerable.
Right, and we as Oregon is a sanctuary state. That's been the law since 1987, that we don't use local resources to enforce federal immigration laws. That's the federal government's responsibility, not the local government's responsibility. And Chief Day confirmed that to Suzanne. So again, please don't hesitate to seek particularly healthcare services if you need, send kids to school. And please I want to encourage everyone to please keep sharing your stories about how this is affecting your life, these funding freezes, these threats, because we want to hear from you. Well, we can take those back to Washington, D.C. with us and use those as a a way to help convince, hopefully, both sides of the aisle that this is not good for our country. I always look at my work as how am I going to create a better future for the people I represent, and with these threats on healthcare, on education, on the environment. I'm on the science committee. We don't want to go backwards. I'm taking money away from scientific research. It's absurd. So please, again, keep in touch, everybody. We want to hear from you.
And you've talked a lot about just the confusion about the funding freeze. What are some things that you do know right now that levers the next steps that you and your team want to take?
Well, we know that there's an Empowerment Control Act. So there's a law that was passed in the 70s. It says that once Congress appropriates funds and passes funds, an executive can't take that away. And then there's a Constitution that gives the power of the purse, if you will, to the Congress. So we know that we have the laws on our side, and frankly, the public is on our side as well. So we have, again, I mentioned checks and balances, and there have been these 2 cases so far. And you know, there was also the case when the president can't just say, you know, birthright citizenship ends because it's in the Constitution. He can't just, that would be like him saying, the earth is flat, doesn't make it so. You know, he can't just change the Constitution by writing an order. So we do have those checks and balances. And we do have, I think the people too are something that the stories that we hear are helping to persuade people that this is not what we signed up for, what people thought they were getting with this president. So again, please keep up your stories, and we will take, of course, we're following the New York court order expires Monday. That could convert over to a longer injunction. It's just a temporary order now. And then we're following the other case, which is in Rhode Island as well. So.
And then, I mean, how long do you think it takes to resolve the freeze?
I have no idea. I know that we will be in constant conversation. The continuing resolution that keeps the government open expires in March.
Okay.
So it's almost February. Right? So when we go back next week, we will be in those conversations about how do we keep the government open. The House Republicans tried to come up with a plan a couple days ago. They failed. They can't even agree among themselves. So it's going to need to be bipartisan. So we will be weighing in then on how we keep the government open and fund these programs. And again, with the Oregon values.
I have a question for Raven or Iris. I'm just wondering if you could walk me through what this week has been like for you guys since the pause was announced on Monday, like the day-to-day was going.
Yeah.
We cried a lot. I'll just speak for me. Iris has had to deal with a lot more of this than you do money things that I don't have to do, thankfully. It's been pretty terrifying. And it's been terrifying not just for thinking about what these freezes could mean for our services. It's been terrifying for thinking about how many of my coworkers could lose jobs and thus lose their housing and thus lose their stability, possibly their sobriety, because of what has happened. You know, we've definitely had a lot of meetings, a lot of budget talks, a lot of like scouring grants to like find out Iris will give you a number. I think it's a large portion of our funding comes from federal dollars, and so the money not coming through to us would be devastating.
We're doing a really, a basic scrub at the very beginning to understand where we're at. It's looking at 80 to 90% of our funding is federal Medicaid from coming through the county money as well as federal funding from Washington County. So we're just part of a bigger ecosystem of federal funding. Speaking to which is that all that back end stuff is like, what does mobilization look like immediately? We still only have until February 3rd. February 3rd is very fastly approaching. So we're making those contingency plans as fast as possible. Having representatives here today, our partners in the OPCA, making sure that we're getting the word out that we are here, want to continue to be here, and this community that we serve is going to stay here as well.
And can each of you say and spell your names for us?
Yeah. IRISMARTIN.
Haven, Haven, Wheelock.
to, we have a narrow minority in the House. None of this is a foregone conclusion. We need to be pressing on our branch of government. The Rust vote confirmation, Tulsi Gabbard, these are not foregone conclusions. And so if our citizens are pushing back and making phone calls and saying that this is a great betrayal, we can get the Republicans to listen. And so I really want to just encourage people not to accept this plan as a foregone conclusion. We need to fight back.
Any other questions?
Thank you so much. Thank you.